Hi, everyone. I think I need to start my presentation with a disclaimer, and it's not working for now. Oh, let me go. Oh, it's okay now. All right, so I'm going to start with a disclaimer, okay? So E.V. White says that if you explain a joke, it's like dissecting a frog. You understand the joke better, but the frog dies in the process. So today, as I'm sharing on humor pedagogy, ironically, I will be explaining my joke. You will understand my joke better, but this joke will die in the process. So if you don't laugh throughout my presentation, that's totally fine. I understand because I'm literally butchering my humor approach. Okay, so I'm Mei Li, and I'm going to share with you about improv, from haha to aha moments. And I would like to begin with a this or that question. So for those on Zoom, please feel free to put on the Zoom chat, are you this or are you that? And for those here on in the room, I'm just going to see a raise of hands. So and this is not a trick question, it's totally fine which one you are. Okay, so who here prefers a serious classroom? Raise your hands. Okay, so who here prefers a fun classroom? Okay, 100%. That's the poll on the live one. Okay, so let's go to the next this or that question. Again, those on Zoom, please feel free to put on the Zoom chat, are you this or that? Okay, now, yes.
I think it's better for them to use the raise hand button because not everyone has freedom to chat on the chat.
Oh, okay. Well,
you can ask them to vote, if this, then use the hand button or something like that.
All right, but it's okay because I can't actually see your raised hand as well. So you can think about it. Okay, they can see the raised hand. Okay, so raise your hand when you say this and raise your hand when you say that. Okay, so over here, raise your hand if you are a planner. Okay, do we have a few from there? We have one. Okay, who here is a spontaneous person? Raise your hands. Oh, it's quite 50-50. So we have 4 spontaneous online. So there are more spontaneous people. Okay, so this slide actually brings me very nicely to my next slide, which I'm going to introduce myself using my MBTI personality. I am a ENFJ. So the J in me makes me methodical. I need to follow a protocol. But the N in me makes me verbally creative and imaginative. So naturally, I kind of need to follow a structure, but I'm open to creativity as well. So I'm actually naturally a more semi-structured person. So my personality also makes me someone who I just like telling stories in a semi-structured way. So today, my sharing will be a narrative, and a story of how I use my humor approach in the classroom. And I will be talking about that according to the Bloom's taxonomy as well. So first and foremost, I want to talk about mnemonics and puns because this is something I used to do a lot in my years of teaching. And some of the more recent examples, let me share that with you. So I teach nutrition, and this is what I tell students. Okay, I'm going to teach you vitamin K now, and I'm going to give you 4 concepts starting with K. They are K helps clotting factors, K crush warfarin, vitamin K is a cofactor of gamma carboxylation, and K vitamin K cannot be found in a newborn infant. So these are the 4 factors, 4 concepts you need to know about vitamin K, all with K, or not really K. And then I also have the responsibility of teaching the TCA cycle. I heard there are a lot of science and biochemistry students in this room, and I know that the TCA cycle, students love it. And when I say they love it, I actually meant they really hate it. And I have the responsibility to teach this TCA cycle. No worries. So I have to teach it with mnemonics. So obviously citrate is a silly, super funny molecule, obviously. So I use mnemonics to teach this kind of subjects. Also, when I teach antioxidant, for example, I tell students this is a concept that you need to know. Antioxidant kicks the free radicals, okay? Just know that about antioxidant. Yeah. So what are the students' response from this mnemonics of puns? So these are the very common responses from students. They love the way to remember things like TCA cycle. The puns, the mnemonics help them with memorization. The lecture has so many tips to remember information. So I thought, wow, great feedback, right? They love the lecture, they love the method of learning. But when I reflect upon this a little more, I realize these are the words that they're using: memorize, remember. And I realized that I was just helping students to achieve the basic level of Bloom's taxonomy, to remember and memorize. So I thought to myself, can I push them up that level a little bit more? How can I help my students not to just memorize concepts, but to understand concepts in a fun way? So the methods that I use are a little bit more experiential. So I use a few methods, and one of them is what I call incongruity. So the incongruity theory states that humor is experienced when one perceives something, the shift from reality. And this shift from reality is so shocking and so surprising that it leaves a remarkable effect. So one example that I can think of was during my biomedical technology class. Okay, I stood in front of a student and this is what I told them. A few years ago, I had, multiple vomiting spells. There was this few times where I got sick for 2 to 3 consecutive days. I just kept vomiting over and over and over again. And I don't know what's wrong with my body, Like I was stuck in a room, no one could get me out. And I was just so sick. I wish someone would tell me what is wrong with me. I wish I have this tricorder device, which was invented in 1960s, to tell me what was wrong with me. And students, they were listening to my story and they were like, there's a tricorder device that was developed in 1960s. They were interested to know more about this device. And then I went on to tell the student, this tricorder device, it's small, it's portable, it's non-invasive. It gives you an instant readout. You just scan the person and you get all whatever that is going on with this person. And then the students were like, I want to know what this device is all about. They were so engaged. They want to know about this. And then I went on to burst their imagination bubble. I said, this device, you can find that in the Star Trek movie. It's the medical tricorder in the Star Trek movie. And by this time, the students were like, they were like laughing and they were like, they want to strangle me. So because they found out that this was fake news. Yeah. And but I told them, I continued to tell them that, but you know what? We have something similar now. It's the healthcare wearable device, your Apple smartwatch, your Fitbit, your Oura Ring. They do exactly the same thing. They are miniature and wearable. They're non-invasive. They have an instant readout. And these are the 3 concepts you need to know about healthcare wearable device. So that's how I started and ended the class. Okay, another method that I use with my students is also edutainment. So I use entertainment like TV shows, video games that can provide some educational content. And some of the ones that I use are like Nat Geo TV and BBC Two. So I would like for you to experience one of the edutainment that I use with my classroom. But can you promise me that when I move to the next slide, you will look at the middle circle, the middle small circle, okay? And please promise me that no matter how long that video is, you will always look at that middle circle, okay? And if your eyes get tired, just look at that middle circle because it would not work if you don't look at the middle circle. Okay, and do follow the instructions that the video tells you, and do follow the instructions that I tell you. If I ask you to look away, then only look away. And do look away at maybe something with a more pattern structure, maybe the floor or something like that. Okay, so let's try. Okay, are you ready? Ready? Alex, you ready? Okay, let's.
Focus on the letters in the center of this image, starting in 3, 2,
turn away
1.
from the middle circle. Do not look anywhere, just the middle circle. You're doing great, keep looking at it. If your eyes are getting tired, just keep looking at it.
Ready? Look away in 3, 2, 1. Check out your hands or whatever's around you. If things look a little wavy,
Feel the
don't
wave.
worry. The effect should wear off in a few seconds.
All right. So this was the experience that I wanted the students to feel like they look at, and they see the wave. And what I'm trying to convey to them is that your brain needs time to readjust to different stimulus. And then I go on to tell them about the brain and the nervous system. Okay. All right. Another next method that I use to create experience is using analogies. So I try to relate daily experience with lecture concepts. One example that I'm going to show you here is I have to teach on cell signaling. Okay, and so here is some slides on cell-cell communication. So this is what I tell the students. So there are 4 types of cell-cell communication. In other words, cell signaling. They are direct contact, paracrine, autocrine, and endocrine. Now, the way cells communicate with each other is just the same as how humans communicate with each other. And let me show you how. So first one, direct contact. Just like 2 human lovers, they pass a message to one another through a direct, gentle touch. Cells do the same. You see here a cell, whatever that's going on inside it, it wants to pass a note to another cell through direct contact, and this creates a response. There you go, definition of direct contact. 2 cells passing message to one another through physical contact. Oops. Okay, second, paracrine signaling. Just like humans, you know, they can pass a message from a short distance without touching each other. The same thing, cells do the same thing. Look at these 2 nerve cells. This is the end of one cell, this is the other end of another cell. There is a gap in between, they're not touching, and there they are sending message without touching each other. So there you go, the definition of paracrine. 2 cells communicating with one another, neighboring cells. Number 3, autocrine signaling. You know, just like humans, you write a reminder message to yourself, right? Same here, cells, they can send signals from themselves back to themselves, and this create a response. So there you go, definition of autocrine signaling. And finally, endocrine signaling. You know, just like humans, we can write a message, post it to a far, far away land. Same thing, cells can do the same thing. So just, for example, your brain creates the hormones, it goes through your bloodstream, go to the whole body, and it passes through all the cells in the body. But the thing is, even though it passes through all the cells in the body, not all the cells will respond to this hormone. Only the target cell will respond to the hormone. So likewise, for humans, you write a touching message with all your heart, and you send this in a post long to a far, far away. So it might take a little bit of time, and it might go to Maybe it might reach different people, but it will not mean anything to the people you didn't intend it, but to the target person, it will have a lasting effect. Same. All right. And another example that I use analogy is with props. So if you look on your left side, don't worry, there's no audio. I'm flashing money to students. Now, why am I doing that? It's for a reason, okay? It's not to bribe them to give me better SFTL scores, but I'm telling them that, you gain so much knowledge in the university so that you can use this knowledge at work, right? And then you work so hard. For what? Be honest, to make big bucks. And then you need to use this money to spend it for your daily necessities. Same with your body. You take in nutrients, and these nutrients is used by your body. Your body works so hard. For what? To make energy in the form of ATP. And you need to use this ATP energy to spend it for your body's necessities. Okay, so another example that I use on the right-hand side is with my torchlight. I on it, I off it. I on it, I off it. I promise I was not playing with my torchlight. It is for a reason, okay? All right, so I was actually teaching the students about cell signaling, and that there is a component in cell signaling that is like a switch. You turn it on, you turn it off. You turn it on, and you turn it off. When you turn it on, it may allow some biological processes to go on. If you turn it off, it may stop some biological processes, the switches in your body. All right. And so, what is the outcome? What is the student feedback from all of this? They ended up making memes out of me. And this was circulated throughout the faculty, throughout all the different cohorts. But it's okay, as long as it has a lasting effect on their studies. Also, I was pulling up all the student feedback. I was trying to figure out what the common words that they use to describe, some of this experiential learning that they have. So they say it's entertaining, it's fun, it's engaging, it's intriguing, and it's informative. And I want to show you some of these comments. Look at the contrast. They said that the concepts were a lot of fun, but it also came along with serious, vivid, and concrete examples. Another one here, the explanation was entertaining, but at the same time, they acknowledged that the explanation's content was both informative and concise. Another one, they say the lectures are so detailed, but the method of learning this was very easy to absorb and digest. And the use of the props helped clarify all these very, very difficult concepts. So from what I'm seeing from the student feedback, that it was not just fun and laughter, but I can see that the students are using this to understand the concepts better. And now, in the next stage, I wanted to put the ball in the students' hands. I want to let the students plan the fun. So I give the humorous instruction, they plan the fun. And what I'm trying to do here is to move them up this ladder of Bloom's taxonomy, up to the highest cognitive domain, create. And so how I do it, I normally do a lot of role plays in my course. Here is one example of a humorous instruction that I've given to them. So here you go. A medical student needs to practice performing a standard cardiovascular examination, check the patient's heart. Okay, and the senior doctor introduced the medical student to the patient saying, this is a colleague who needs to examine your heart. But the problem here is the patient has not come in with any heart-related concerns, no history of heart problem. And so what I want the students to highlight in their role play is issues on consent and communication. And so I let the students have this instruction, let them plan their script and do the role play in front of the class. And I just want to say that I'm not able to show the video of the role play because of confidentiality issues, but I will narrate perhaps the script that they have created. Okay, so maybe just use a little bit of imagination for yourself how this goes, okay? So first, the senior doctor was chatting with the medical students and decided to let this student practice an examination on the patient. However, the doctor lied to the patient, saying that about the medical student. He did not tell that this was a medical student, but instead, he introduced the student as his colleague, another doctor, who is going to do the examination on the heart for the patient. So let's see what the patient responds.
Hey, I don't remember entering the hospital for chest pain. I don't remember my heart feeling bad. It's a heartache. Nothing but a heartache. Wait. Excuse me, doctor, is something wrong with my heart? Ah, yeah, my blood test. Was something wrong with my blood test?
Okay, so lots of questions, lots of confusion from the patient, to which the doctor replied, you don't have to worry about any of this. And the student went on to continue doing the examination. Let's see what the patient responded.
Wait. What did you do? What? Ooh, you're touching me. Hi, doctor, that isn't my chest. That's my kidney. No, don't touch me there. That's my spleen. Woo! Ah, what are you doing? Woo! Ticklish. Woo. Oh wait, that's not tickles. That's pain. Doctor, pain. Hi. Painful, doctor, painful. Whoa! What are you doing?
All right, so obviously a very incompetent medical student at this point here. But you know, it didn't stop here. We actually went on to do reflection, and that's where the learning actually comes. So we asked the audience and actors to reflect. So the audience reflect what you have just observed and how this should actually be done correctly. And then for the actors, tell us, reflect about what you have experienced. How do you feel as a patient? How do you feel as that doctor? And what could be better? And overall, you know, the group feedback is very commonly this. They always feel that, you know, this teaching and discussions on medical ethics, medical humanities, and doctor-patient communication is often very dry and very theoretical. It's all about, you should do this, you should not do this, you should do that, you should not do that. But what they really enjoyed were the role plays where they could immerse, they can make mistakes, and they can reflect on it and learn deeper from it. So I've always been thinking how to have fun in the class, but actually make it a lasting impact on their learning. So instead of just helping them to memorize, to help them understand the context and even put the ball in their hands, let them create and hit the highest cognitive domain. So initially, I started my presentation with, are you this or that? But actually, I learned that you can be this and that. You can have serious learning, but a very fun and relaxed learning environment. I also asked, are you this or that? But again, I realized you can be both. You can be a planner, but you can also leave room to be spontaneous. And my approach is semi-structured. So if I do humor in classroom, I improv. But at the same time, I hope students will improve in their learning and that they will transition from just haha moments to aha moments. Yeah, thank you. That's my talk.
Dr. Khong, any questions from the audience, please? Sorry?
Zoom? Sorry.
We'll check it for you.
Okay.
They will check the question. Anyone from the audience? Oh, we have. The mic, please, over there. Yep.
Thank you so much. It's so inspiring. My question is very basic because I'm like a new PhD, new teacher, and I'm not accustomed to like such creative use of graphics. And some of yours are really good and also really specific, like the teachers. No, the medical student.
Oh, the role play.
Yeah, the role play
Mhm.
graphics. So I'm just wondering, like, do you just search on the internet and like
Ah.
use some search words and then find exactly the one, or
This
do
one?
you, yeah, or do you use some
Oh.
tools to create
Oh, I
like
use
AI?
Gen
or-
AI.
Yeah, that's what I want to ask.
I use Mid Journey.
Ah.
Yeah. So took me some time to get the right image that I want, but it worked at the end.
Oh, okay.
Yeah.
Yeah, cool. Thanks.
Any other questions from the audience, please?
Hey, I would like to say I really like how you like teach. I think it's really inspiring too. But
Thank
a
you.
point that I have tried volunteering teaching, I noticed that like if we have to teach like a lesson every day or something, you don't have time to think that deeply about what you teach. So I think many of your like your ways of integrating humor require a lot of preparation, like the flashlight or the video. So how do you actually do it? You need a lot of effort to yeah, do it for all the stuff you teach.
Oh, I think that well, definitely there needs to be planning involved because like I said, I'm a pretty structured person. But when I explain it, I go a bit creative. But yes, you do need to sit down and plan it. But then there are a few ways which I draw inspiration from. One way is that I'm actually quite observant about my surroundings. Yeah. And sometimes when I see something interesting, I was like, "Oh, I can use that in class." So just being very sensitive to your surroundings and knowing, oh, maybe this is good an analogy in my class. Or even going back to the content, I had to teach on cell signaling. I know students aren't that's not students' favorite subject. But then I have to teach about basically G protein, the switches. And I was thinking, yeah, they keep saying it's a molecular switch. It turns on and off. So can I find a switch in my house? Obviously, I cannot bring my whole switch, but I have a torchlight which has a switch. So just thinking, like relating to the daily things that you encounter, because if you're able to bring out the daily things, your student will be able to relate to it too. Another thing that I use is I brainstorm with my husband. So maybe try finding a friend to brainstorm together what, cool analogies or puns or whatever that you can use for your teaching to make it relatable. Yeah.
Okay, thank you so
No
much.
worries.
Hi, Mei Li. I think like I enjoyed a lot, of the presentation. So that reminds me a lot of the biology classes, a long time ago. I think, this is really, helpful to help students, the basic concepts and how very important concept, but I'm thinking about like the applicability in terms of like to some specific areas. Now, most people would say like math will be very boring and things, the process. We can still find like human, relations, kind of activities that can relate. Can you think of maybe some subjects that will have problems, to integrate this kind of approach into it, that it would be difficult to find like, human elements that you can actually make the concept accessible, to them. Like I'm thinking about astronomy actually, or yeah.
Oh, astronomy might actually have some very interesting things.
That's good.
Yeah, but except that I can't think of any because I'm not an expert in the subject. To be honest, I probably can't answer your question because I feel like you might need to be also a content expert, a subject expert in that to be able to think of, oh, what creative ways you can relate daily observations to. But how about this? Maybe just having a mindset in life of fun, a fun mindset in life. So everything you see, what fun can I put in there? Oh, I can put that in for fun. Yeah. I think perhaps start with that, and it might lead the way towards having some creativity in the different topics. But I think all topics can have some form of creativity. It's just planning it and thinking about it. Yeah.
I do actually remember one or two funny humor pictures of for astronomy. So there are certainly things like that. If I can remember, I think it was a picture of like a sun, solar eclipse or something like that. And then another picture was like the sun actually crashing down. That's like apocalypse.
Oh,
Maybe some of you have actually seen that before. Yeah, so yeah, I like these things. So I have a tendency to remember these. Yeah.
I see.
Yeah.
I see. There you go.
I think just like you, sorry. So I think just like you said, it really comes down to creativity and whether you're really, expert in that area, which you would actually allow you to expose to more of these things as well. Yeah.
I think I'm naturally not a creative person too, but then I get my creativity by observing and watching things. So like I told you, I watch a lot of those brain games video. And sometimes documentaries. There's some very funny documentaries as well. So I think just be open to exposing yourself to the many media, and you might find some inspiration that I really wasn't creative to begin with. Yeah.
Any other questions? Well, if not, then we are all done here. Thank you very much, Dr. Khong.